I take my pleasure to call Dr. Preksha BIRADAR. She'll be talking on Lacrimal Tumor Chronicles.
Good evening, one and all. So, lacrimal gland tumors account for about 10% of all the biopsied orbital tumors. They can either be benign or malignant with overlapping clinical presentation, making the diagnosis challenging. So, malignant cases typically have a poor prognosis. However, with the help of clinical evaluation, imaging, and histopathology, we can reduce the misdiagnosis and improve the patient outcomes. Coming to aims and objectives of our study, it was to analyze the spectrum of lacrimal gland tumors, to evaluate clinical diagnosis accuracy versus histopathological findings, and to identify the patterns to reduce the misdiagnosis of malignant tumors. So we did a retrospective cross-sectional study of 100 cases and included patients with lacrimal gland tumors undergoing surgical excision, and histopathological analysis was done in that, and we excluded those which have incomplete imaging or incomplete workup, like showed no lacrimal gland involvement. And we graded the tumor based WHO grading was done of Goto et al. For IgG4 related disease. So in our study, 60% of the cases were benign, 28% were malignant, and 12% were initially misdiagnosed. The most common malignant tumor were lacrimal gland lymphoma and adenoid cystic carcinoma, while the most frequent benign lesions included non-specific dicroadenitis and IgG4 related disease and pleomorphic adenoma. So here are some interesting cases. This patient presented with bilateral painful proptosis along with the enlarged parotid and cervical lymph nodes. A PET scan showed multiple FDG uptake sites, raising the suspicion for lymphoma. Then, however, histopathology and immunohistochemistry ruled out lymphoma, confirming the diagnosis of IgG4 related disease with systemic involvement. Orbital salivary glands and pancreas were also involved. Coming to second case, this patient had a 4-month history of left eye bulging and a prior history of breast cancer. Then histopathology revealed metastatic breast carcinoma in the lacrimal gland, emphasizing the need for thorough systemic evaluation in such cases. Coming to third case, this patient presented with left eye fullness and was initially suspected of having the lacrimal gland tumor. Imaging also shows the soft tissue enhancement with no bony erosion. Further investigation confirmed that it's a sarcoidosis, highlighting the importance of considering the inflammatory conditions in the differential diagnosis. Coming to fourth case, this patient had a right eye swelling that was ultimately diagnosed as high-grade ductal carcinoma because the imaging has not given enough clue. Hence, the histopathology confirmed that it is high-grade ductal adenocarcinoma of the lacrimal gland. So the key challenges were the clinical presentations overlap between the benign and malignant lesions. Imaging limitations was imaging alone gives the makes it difficult to differentiate the aggressive tumors, and IgG4 related disease and sarcoidosis remains the most commonly misdiagnosed benign tumors as malignant. And multidisciplinary approach involving ophthalmologist, radiologist, and rheumatologist is important for better management. So a structured multimodal approach significantly reduces the diagnostic errors. Early biopsy and histopathology are crucial in preventing delays in the treatment. Improved awareness of atypical tumor presentation helps lower the misdiagnosis rates. In case where malignancy is confirmed, life-saving interventions such as orbital excision becomes essential to prioritize the patient's survival rather than preserving the vision. Here, these are my references. Thank you.
Yes, something to say? Nothing to say as such. I feel there could have been larger number of cases, to see any type of correlation between radiology and clinical presentation. So yes, whatever you said is true regarding lacrimal gland tumors as such. Thank you so much.
Thank you.